Greetings to all my friends and Miss Ibiana. Today our group would like to presenting about the NGO's activities that actually contribute to the development or development administrations. Before that, I would like to introducing ourselves first. My name is Muhammad Azri bin Rohaizad, and together with me is Nur Aina Syazwani binti Arman, Siti Adina binti Ardinan, and Mari Imedin Nicholas. I'm going to talk about the introduction first. Commonly, development is a very crucial process to occur in the country, as it will bring such a positive change that is needed in a particular time in order to improve the standard of living of the people. Thus, we need some kind of the non-governmental organizations to ensure the continuation of development in our country and participating at the international level to help those who are needed. One of the NGOs that contribute to the development is Mercy Malaysia, that is known as a Medical Relief Society Malaysia that operates in humanitarian relief fields. Right now, they have over 400 members and over 17,000 registered volunteers. In the last 2 decades, the organization has provided humanitarian assistance and programs in 32 countries in crisis and non-crisis situations.
One of Mercy Malaysia activities in 2010 is private vaccination clinic for the Myanmar refugees. Since 2007, Mercy Malaysia has collaborated with the United Nations High Commissioner for Refugees, or known as UNHCR, the Taiwan Buddhist Suu Kyi Foundation Malaysia, and the Czech Republic to provide medical assistance to Malaysia's person of concern, especially the Rohingya Myanmarese community. This was started in response to the difficulties they face in Malaysia, especially in terms of healthcare access and provision. Mercy Malaysia began a vaccination program for Myanmarese persons of concern residing in the Ampang, Cheras, and Selayang areas in July 2010 in partnership with all stakeholders. To date, Malaysia has taken in an estimated 42,309 Myanmar refugees, including 15,800 Chins, 15,200 Rohingyas, 4,000 Myanmar Muslims, and the rest from other minority ethnic groups. The UNHCR collaborated with partners to secure and support refugees and asylum seekers who had been registered. There are approximately 14,200 children under the age of 18 and 7,000 children in kindergarten. Mercy Malaysia began a vaccination program for Myanmarese refugees residing in the Ampang Cheras region in July 2010 with the support of UNHCR and SCR. Mercy Malaysia is one of the few non-governmental organizations or NGOs in Malaysia that conducts the vaccine outreach clinics. The children of the Myanmarese community which under the age of 18 years old who have not completed the vaccination course are the intended beneficiaries of this vaccination clinic. Mercy Malaysia offers free vaccination to protect these children and the communities in which they are reside from the diseases mentioned below, such as tuberculosis, diphtheria, pertussis, tetanus, measles, mumps, rubella, polio, Haemophilus influenza B, and hepatitis B. Due to the complicated requirements for vaccine storage and cold chain processes, as well as the related expenses, Mercy Malaysia is one of the few NGOs in Malaysia that runs vaccination outreach clinics. By providing free vaccination services for the Myanmarese refugees under the age of 18 years old, the health of Myanmarese refugees will be guaranteed and can prevent the spread of new diseases outbreaks to this community or country. As we already know, vaccines such as hepatitis B, tuberculosis, polio, measles, and other vaccines are given free of charge to all the Malaysians who age 18 years old below, and this practice is also applied to Myanmar refugees through activities conducted by the Mercy Malaysia. The vaccine given to Myanmar refugees is very important because diseases such as tuberculosis, measles, hepatitis B, and so on are frequent attacks children and has serious complications compared to the other diseases. This is done through vaccination for the formation of antibodies to build immunity body. Vaccines are viruses or bacteria that are killed or weakened and given by injection or by mouth. The vaccines given to Myanmarese refugees provide health benefits to children because they can avoid being infected with various serious infectious diseases, which can result in disability and death. Vaccination also can prevent the occurrence of epidemics and infectious diseases. This is because, with the provision of this free vaccine, the health level of Myanmar refugees in Malaysia can be guaranteed and the health level of the people in Malaysia is also maintained. Therefore, the efforts made through the activities of free vaccination services for Myanmar refugees under the age of 18 years old must be supported by any party, either government or non-governmental organizations in Malaysia.
Before Mercy Malaysia carry out this activity, they will establish a various factors to ensure the success of providing free vaccinations to the Myanmarese refugees. Those efforts are by providing information sessions to the Myanmarese refugees that will held around the Selangor, specifically at the Ampa and Selayang. Basically, there will be a question and answer sessions. By doing so, Mercy Malaysia will eventually be able to increase awareness of the importance of getting the vaccinations and willingly to get the shot. Moreover, Mercy Malaysia work closely with the people through a dedicated Myanmarese community support workers, whose roles includes following up with the return patients to ensure their commitment for subsequent appointments. The community workers also make house visits to consult with the parents into getting a second and third doses of the vaccinations for their children when it was required for them. Through the partnership with the UNHCR, they getting a 3 until 4 the interpreters to assist the patient at the clinic, as many of the Myanmaris can only speak their native language only. Furthermore, Mercy Malaysia already enlarged their organizations to the national and international knowledge in order to increase the number of donors. They encourage all the people to donate with them through the RM Sehari, where each day is RM1 donation per person. Spreading awareness to the public is very necessary because it involving everyone in the humanitarian act will make it much easier for Mercy to carry out any activity that they wanted to do.
First of all, the outcome that you can get from this program is we can increase the human body immunity, because body immunity is a natural shield that helps to protect human body from any harmful germs by generating natural antibody inside human body. So by accepting the vaccine injections, it can help to boosting the body immunity system from any bad germs, especially COVID-19. So when Malaysia give vaccine to Myanmar refugees, it helps Malaysia to get higher rate of recovery because the number of people with strong immunity is keep increasing day by day.
Hi, I'm Aina, and I will continue with the outcomes of Mercy Malaysia with the refugees vaccination program. With providing free vaccination to Myanmarese refugees, it can help our country Malaysia to overcome the pandemic of COVID-19, as the average of infected people are keep increasing instead of Malaysian citizens. When these Myanmarese refugees are also being vaccinated, this is easy for our country to recovering from this pandemic.
Second is the humanity right always come first. Malaysia is the only country that want to provide free vaccine to all refugees coming from Myanmar, and most of the program is carried out by the NGOs, especially Mercy Malaysia. Even though the program take much expenses, but it's still carried out by the NGOs because everyone is deserved to get the vaccine.
In addition, Malaysia is being an example among all of ASEAN countries which wisely controls the spread of COVID-19. Malaysia was named one of the top 5 countries to follow as a model and example of control during the pandemic. Malaysia is a pluralistic country. They are very concerned with the people's welfare and do not look for the nation or race. Hence, this will make Malaysia great in other countries' eyes. There are also challenges that exist, which is the problems of barrier language. Since some of immigrants do not have a proper education and only know their language, even though there are some translators, Mercy still needed more in order to attract this group of people because some of them might be afraid to take the vaccination. Moreover, Mercy also faces the challenges from the financial aspect, which is the lack of funds and donations. Although there are many funds and donations coming from various groups of people and organizations, Mercy still needs continuous funds and the donations itself due to many quantities of people, since the vaccine itself is also costly and needed a big budget.
The next challenges faced by Mercy Malaysia is the group of refugees difficult to track because they enter the country by illegally and most of them doesn't have any official identity card and health information as reference. They also prefer to hide and flee from one place to another place just because want to avoid the authorities. So it is very hard for Mercy Malaysia to track their current locations.
Several recommendations are being suggested for Mercy Malaysia in overcome these challenges. Since the vaccination is costly and need a continuous donations and funds, it can be done through the government contributions. With this initiative, when there are enough funds and budget targeted, the Malaysia country can cooperate with the ASEAN pool procurement and regional production of COVID-19 vaccine. This will help to keep low the cost and consistent supplies. In addition, Mercy Malaysia can do collaborations with the other NGOs in the ASEAN countries and together support for the vaccination funds and supply for the refugees. Since there are many immigrants that enter the ASEAN countries, cooperation is needed and together faces the issues. Therefore, not only the pandemic issues that can be recovered smoothly, but the health development and harmonization of the country are also being increased.
Other than government contributions and collaborations between NGOs, Mercy Malaysia also need to find more translator to help in terms of communications, because a good interpreter can help in conveying the message using different language such as Arabic and Rohingya language.
To recapitulate, the poverty in rural areas can be categorized as the last state of condition. So we would like to change the standard of living of the people in rural area, in which we can help them to minimize their burden so that they have an opportunity to receive a better quality of life just like the rest of the people in the country. Today we can see the improvement in terms of healthcare services in the national as well as international level. Usually, those living in a rural area facing a shortage of healthcare services due to their locations that is far away from the city area that can limit the movement for the government to provide medical treatment, especially when they live in extreme poverty. This will make them far behind in receiving good health facilities. Fortunately, in Malaysia, we have Mercy to encourage further progress to occur in our country and other countries as well in order to fulfill the development objectives. Mercy Malaysia is a non-profit organization that operating on a global scale. Therefore, the establishment of Mercy has provided a significant amount of volunteering activities in order to boost the quality of life of those in need. I think that's all from us. Thank you.